Hello and welcome to our Q&A session with some of our faculty members here in the School of Optometry at Massachusetts College of Pharmacy and Health Sciences. My name is Hannah Campbell. I am on the admissions team and I work with all of our prospective students for the School of Optometry. And I'm also joined here with four of our wonderful faculty members. And I'm going to ask them to introduce themselves, showing where they're from and what they teach. So without further ado,
All right, I'm Dr. Kathleen O'Leary. I've been with the school for a little over 12 years now. I'm from the New England area originally and knew I wanted to be back here for my future career and work with students. I primarily teach in our pediatrics and binocular vision curriculum. I'm in class, lab, and in clinic.
I am Dr. Jennifer D'Amico. I grew up in this community, left to go to college and grad school, and came back here to Worcester, and an optometry school opened up in my backyard, which was very convenient. I teach optics, I teach practice management, I'm in the clinic, and I precept in here and also at the offsite.
and Dr. Beisch.
Hi, I'm Larry Bache. I'm the Associate Dean of Research and Professor here at MCPHS. I came here from Dallas, Texas, not a native of the Northeast. And in addition to overseeing the faculty and student research that goes on here, I teach cataract and refractive surgery, laser techniques, advanced imaging, um, research and statistical design, and visual neurophysiology and visual neurodiagnostics. I'm also in the clinic seeing patients.
I'm Dr. Greg Waldorf. I grew up in Kansas. I went to school in Oklahoma at the School of Optometry there and moved out to the New England area by way of Chicago, where I did a residency in pediatrics and binocular vision. I'm the Associate Dean for a clinical program, so I am in charge of all things clinical education. And one of the things Dr. O'Leary didn't mention is she's the instructor of record. So we collaborate a lot on making sure that our clinical program and the educational aspect of it is up to par. I teach the ethics course, I teach public health, and I teach a course called Special Populations and Topics, where I teach you how to examine the non-traditional patient.
Thank you all for those introductions. And I think anyone that's tuning into this session would also be interested to hear a little bit more about your background and what ultimately led you to becoming an optometrist and ultimately to teaching where you are today. If you wouldn't mind sharing that as well.
So I originally wanted to be a kindergarten teacher. Always knew I loved working with kids, but I actually got a job as a tech working with an optometrist on a whim when I was in high school, and they love pediatrics, and that's really just what made me fall in love with the profession. And I think now working in academia, I kind of mesh the best of both worlds. I'm teaching, but I also do still see a lot of pediatric patients.
I originally wanted to be an opera singer. My undergrad degree is in opera, and but at the time, well, probably still today, there was no money to be made in opera unless you were super, super, super great. And so I turned to science, which I always loved, and math and science together is optometry, and here I am. I was in private practice for 25 years, and then had a big life shift and started as an adjunct here at school teaching in the clinic, and now I'm teaching in the classroom. I've been full-time for about 5 years.
I grew up knowing, not thinking or believing, but knowing that I was going to be a thoracic surgeon. But life happens, and I got enticed into the profession of optometry and never looked back in regret. It's been a wonderful experience. I've worn a lot of hats. I've been everything from a researcher to a company owner for cataract and refractive services, a vice president of research and development for a company. I spent 30 years in departments of ophthalmology, and it's just wonderful teaching in the optometry program here at WPHS. I mean MCPHS. You can edit that out, can't you, Hannah? So it's just been a wonderful career, and it's optometry is a incredibly rewarding and you'll never go home without telling a story about one of your patient experiences.
I've known that I wanted to be an optometrist since I was a sophomore in high school. I love science. I knew I wanted to be something in the medical field, but I wasn't exactly sure. And I had a great relationship with my optometrist. I was in private practice for like 20 years and kind of at a mid, um, um, career shift. I took a full-time position at MCPHS and have not regretted it. I've been here for 10 years. And kind of like, everybody's alluded to, I mean, it's a fabulous profession. There are so many different aspects of it, between, private practice, education. I mean, there's commercial practice. You can do OD, MD. So there's all sorts of things you can do with it. And I never really figured I would live in New England, coming from the Midwest. But just there's so many opportunities for you. So I applaud you on your decision, and I can pretty much guarantee you're going to be happy.
Thank you all. That was such a fun question. I loved hearing your responses there. So we'll get into the nitty-gritty questions here that I've prepared for you. Of course, we're going to have some applicants that will be considering a number of different programs out there for optometry. But what is it that you think sets the School of Optometry at MCPHS apart from other programs that are out there?
I think that everybody, it seems kind of weird, but there's kind of this cool vibe at our program. And I think it has to do with the fact that we're small. I think it has to do with the fact that we're new. And the vibe I'm talking about, it's just very comfortable. I mean, when I completed my residency, I was like, I am never going to go into academia because there's too much politics. There's just too much going on. I'm not interested. And when I was invited to teach a PEDS course at MCPHS, when I would come on campus, I mean, it was just different, and so I hate that cliche, oh, we're family, but we get along, we have a common goal, we want our students to succeed, we want our program to succeed, and so we all will work extra hard for and with students to help them achieve, their goals. And I think when you come on campus, I've had several students and applicants that even tell me that they feel that. And, it's just a very welcoming environment. We want to support you and we want to help you reach your goals of becoming an optometrist.
Thank you very much. And on a similar note, how would you describe the culture among students in the program?
I would say that the culture is what sets us apart, just like Dr. Waldorf was saying. We genuinely want you all to succeed. And also the students want each other to succeed. It's really a collaborative environment rather than a competitive environment, which some schools have a very competitive environment. But here we find like students share resources, they share notes, they support their classmates, and they do a great job of celebrating each other's successes, which is really fabulous. A place that you can really grow as a as a clinician and as a student and as a friend. It's a great environment here.
Thank you. And if anyone is needing to reach out for any support, whether it be academic support or personal support, how supportive are faculty and what resources are available to students?
I
Also,
mean, I would challenge anybody to find a program that is more supportive of their students than we are. I mean, and I love that. I love that about our program. I mean, really, unless it's like during proficiency week where there's a lot of office hours that need to be done, most of the faculty have an open access. Like if you need to talk, you have a problem, you have a question about something in the course that you're taking, they are there. I mean, we are there to help you, and we love when students come in and visit. So it's just that that openness that I think is really helpful. We do provide, there's a lot of access to peer tutors. There's the Center for Academic Success and Enrichment, also known as CASE, where if a student is struggling, that they can get additional resources. If they're going through a hard time, they can get access to counseling services and stuff like that. So I think the accessibility to the faculty and to all of the resources at MCPHS are really kind of special. And again, I think that's also what contributes to that kind of cool vibe that we have, where when you come in, we bring you in and we'll take care of you.
Thank you for that. And MCPHS is also a bit unique in the way that we have 9 different professional healthcare programs here on our Worcester campus. So, a big, I guess, experience that students will have here is through interprofessional education or IPE that really plays a big role in the student experience. And in what ways have students been able to collaborate with other programs throughout their time here? And I guess, in your opinion, how have these initiatives prepared them to encounter real world scenarios that they'll have as an optometrist?
Yeah, so one of the big events that all students take place in or take part in is something called roles inventory during first year. The way that I like to think about this is all the students from the health professions get together. You're mixed up and sitting at a table with, again, all different programs. And really, I think a big overarching goal of that day is to talk about scope of practice and talk about who potentially you're going to be referring to when you're in clinic, as a student, but also when you graduate as well. And I think something that also just comes out of that as well too is you get to meet other students on campus. Yes, you're going to spend a lot of time, with people who are in your cohort in the optometry program, but that really is a great time to get to know other students on campus as well. More recently too, we just did an opioid use disorder training day with all of our students as well. And I actually took part in it with our students too. And one thing that I took out of it was, optometrists, we're not necessarily treating the opioid use disorder in a patient, but what I took out of it is how can we talk about opioid use disorder when we're gathering case history from a patient, and what are our best ways that we as optometrists can support those patients, or again, other health professions that may not necessarily be treating that patient's, opioid use disorder in the clinic.
Thank you, Dr. O'Leary. That was refreshing to hear all these new initiatives that we take part in. And I have a
Also,
great question.
Hannah, from a social point of view, our students live with PA students, with dental students, with physical therapy students, and in this whole milieu of interprofessional education, and just in their conversations, they learn a lot about each other's scope of care. So, by the time you'll get into practice, you are not unfamiliar with these other disciplines that you could refer to. You have a patient, for example, with a stroke, comes to you with visual problems from a stroke, and that usually these patients also have gait problems, walking, coordinating, and you'll be familiar with physical therapy and what they can do for your patient. So it's a just sort of an osmosis type of absorption that they get just from being here is very important.
Absolutely. And Dr. Bache, I actually have a great question for you. What research opportunities are available to optometry students, and how can our students get involved if that's something that they're really passionate about? And if you can give any examples of some research that's been previously conducted, I think that'd be interesting
Mm-hmm.
to hear too.
Sure. There are two different levels where students can participate in research. On one level, they can participate in an existing faculty research project as a research assistant, and on another level, there are grants that are actually available to our students, so they can design and carry out their own research project with a faculty mentor. And these awards come in the form of $4, $5, $6,000 that they can use for equipment, for research subject payment. And a number of our students come from research backgrounds. They'll have participated in undergraduate research, or they'll have worked at a lab, and they like to continue that. So there are lots of opportunities if they're motivated to do that.
And what are some things that our
Another,
students have
yeah,
done in the past?
one big example is we had a project that there's a drug called Plaquenil, or hydroxychloroquine, that is a very commonly prescribed drug for a number of different disorders, and is actually toxic to the eyes. It could cause serious vision loss. And there's been an effort over the last 30 years to come up with a good diagnostic technique for early diagnosis of this toxicity. And we have a student did a project using something called dark optometry and found that this was extremely sensitive to the losses caused by this drug. And we are now, that student, has continued on the research, and we're actually going forward and writing a larger grant to continue the research in uh, multiple locations, multiple universities around the country. So that turned out to be a very important project. That's just one example.
Well, thank you so much. I'm sure you could go on and on about all the different partnerships and things we've done over the years. I know of a few myself, so I always find that very fascinating. But for the sake of time, I guess we'll talk about some other important factors that students can take advantage of within the program. And one of those being our Master of Public Health dual degree program that they can complete simultaneously with their optometry studies. Can you guys explain how this works and what are the benefits of pairing an MPH with an OD?
Yeah, I went through the program from 2017 to 2019, and honestly, prior to that, I really didn't even know what public health was. I just never paid attention, and I mean, I regretted not having done this like 20 years earlier. But what it is, it's an online program that you can take after you've completed your first year. As long as your GPA is at least a 3.0, you can apply to the program. The program, I mean, you can take, one or two courses per semester. I think most students typically do one in addition to their coursework. And it's very flexible in terms of like, what courses you take when. There are more intense parts of the optometry curriculum, like as we get closer to National Board of Examiners and optometry, the national board exams. So sometimes students will like pull back on those semesters and maybe not take an MPH course. But the thing that I really loved about the whole process was that each of the courses you can really tailor to an interest you have. So my interest is pediatrics and children with visual impairments. And so each of the courses I was able to take some, to kind of explore pediatrics and visual impairment through the lens of public health. So it was really cool. So if you wanted to do more like ocular disease, you could do that. In terms of like, what is that going to do for you? I mean, it looks amazing if you apply for a residency when you graduate. Even if you're going in for a job. I mean, I just think it opens more doors by having that behind you, and it just makes you able to you really kind of talk the talk, a little bit more in terms of healthcare. I also think health is a huge practice management thing. I mean, there are so many things in public health that we have access to that you may not know of that you can really apply to your practice, when you graduate. So there are so many benefits.
Absolutely. And it is a big advantage to be able to complete it simultaneously with their studies at no additional cost. So definitely encourage students to consider that when the time comes, a year from now, if they enroll. Another thing that we emphasize in our program is the early clinical exposure piece. So, how much hands-on experience do students really get before they start to see patients?
Yeah, so students do get to start seeing patients fall semester of second year. Like you're in primary care clinic. But prior to that, first year really is a lot of basic science courses, optics courses, but also a big part of first year is what we call OTM lab, which is optometric theory and methods. And that's really the lab where you're learning all the skills to do an eye exam. You're in OTM lab fall, spring, and summer semester leading up to clinic, and you're in pre-clinic a lot, practicing those skills. But we also do invite you into our Eye and Vision Center to shadow second, third, and fourth year optometry students during first year. But then you're going to hit the ground running fall semester of second year. It's an exciting time in clinic. And to be honest, too, you really still don't have all the knowledge to do a full eye exam yet. But we do think it's important for you guys still to start early in clinic because you get to learn to communicate, talk to patients, and really start to refine those skills that you had in pre-clinic from first year.
Excellent. And how are you guys able to help these students connect what they're learning in the classroom to what they'll ultimately encounter when they're in clinic?
So this is on my mind all the time because I teach optics, which is like day one of year one. And then I'm in clinic in second, third, fourth year. And we see things in clinic and I say, oh, my optics kids, they should learn about this in optics. And I try really hard to bring clinic into optics because it makes optics that much more interesting because there's a lot of legwork before you actually get to the place where that first year is, it's arduous. And so, that you finally get to clinic, and then you get to clinic and you feel like you don't know anything. And all the stuff you learned, does it pertain? But it does. We try really hard, especially in that first, those of us who spend a lot of time with the first years, try and get clinic to come down to first year so that they can appreciate why they're learning what they're learning and how are they going to use it when they go forward.
Mhm. And of course, as they're, gaining more experience and seeing more things through not just the Eye and Vision Center, but our EMK community health centers, they'll start to see all sorts of unique conditions and things. So what would you say to students that are coming into the program in terms of like what are the typical patient populations or conditions that they can expect to encounter in any of our clinics that we send students to?
Yeah, I can start with the Eye and Vision Center in second year, and then I'll let Dr. D'Amico take it over for EMK since she's at the health centers a lot. But I always like to say again, fall semester, second year, when you start in our primary care clinic, patient number one that you could see could be a student from another program who's coming in to get their yearly exam and be otherwise healthy but just needs an updated prescription. Or on the total opposite end of that could be patient number one who just moved to the US, who's 70 years old, who's never had an eye exam, never been to a primary care doctor before, and you end up diagnosing diabetes, high blood pressure, glaucoma, and you have to then try to find your patient in the US now, an established primary care doctor, and that whole exam is all done through interpreter services as well. So it really does stretch the whole gamut. And that just, I think, is because we're in Worcester. Worcester is an incredibly diverse city. We get a lot of referrals from outside optometrists and ophthalmologists as well too. But that really is second year primary care clinic. It really could be anything that walks in the door. And then as students get to third year, they really delve into our different specialty services as well, being glaucoma and kind of integrated into that service is also laser clinic where we have an ophthalmologist come in to do laser procedures and our students observe that. Pediatrics, binocular vision, contact lens clinic. I like to say contact lens clinic. Yes, you'll have the patients coming in getting contacts because they don't want to wear glasses, but it's also a very big specialty contact lens clinic too. So a lot of patients with diseases of the front of the eye. Low vision rehab clinic, a lot of referrals from outside ophthalmologists. And then more recently, as Dr. Bates talked about, we have electrodiagnostics clinic as well. So lots of referrals in the Eye and Vision Center. And then Dr. D'Amico can speak to our offsite community health centers.
Yeah, we have one community health center that has 3 locations. One's here in Worcester, so similar patient-based to what Dr. O'Leary was talking about, not the student, but the other patient. And then one in Framingham, which is but Framingham and Milford, those are both probably about 30 minutes each away. You start going there in your summer before your third year, and you're there. Well, they were there seriously this summer, and then legitimately in third year and fourth year if you choose to stick around here. And the healthcare population, community healthcare centers tend to be a sicker population, and the sicker population comes with more eye disease. So we see a lot of very interesting things that we don't necessarily see in a regular practice. The EMK center that is in Worcester, literally we share a front desk with urgent care, and so if any eye problems come through the urgent care, we have a good relationship with them. They just bring them over to us. We get to see all sorts of fun urgent care things, which, like I say to the students, the more exciting it is for you, the less exciting it is for the patient. So we have to manage those emotions, but it's a great environment. Again, a lot of translation services, or if you speak a language, whatever language you speak, it is so likely that you will get a patient that speaks that language.
Absolutely. Thank
We
you,
really
guys.
do have a spectrum of patients coming through our Eye and Vision Center. Everything from city council members and members of our local minor league hockey team, which is down the street, to people who have not only not seen an optometrist before, never seen, as Jennifer said, a doctor before. So the experience is amazing.
Absolutely. Can go to 0 to 100 pretty quick, depending on your patient, I suppose. So of course, optometrists utilize a lot of different diagnostic equipment in your day-to-day. How do you think that the School of Optometry incorporates technology and innovation into our classroom and clinic? I think this would be a good question for you, Dr. Beish.
Well, our school is, since the school was first conceived in 2012, we've been committed to having absolute state-of-the-art equipment here. We have the latest technologies, and we have a replacement policy where if a instrument is at end of life, we replace it with another state-of-the-art system. So as Dr. O'Leary said, for example, we just got a brand new electrodiagnostic system so that we could look at how the eyes and the brain talk to each other. And we've got new imaging systems that are extremely high resolution. Um, we really do have the best in just about everything. One of the other thing I'd like to emphasize is that some people are reticent about applying to a school in Massachusetts because we don't have surgical privileges here for lasers. But I want you to know that the education you get here in laser surgery and especially in the practical aspects of laser surgery, where you're using the lasers themselves, is unsurpassed. We actually had one of the first laser education programs in the country, and we continue to develop that. So you'll be ready to hit the ground running when you need to go, if you want to return to a state that has more advanced scope of care than Massachusetts does.
That's a great point. Yes, we do teach the full scope of practice here. So even though you can't play with lasers as a practicing optometrist here in Massachusetts, we will prepare you for whichever state you choose to practice in the future. So another big component to the student experience is, of course, preparing for national board exams. So I'd like to ask our faculty, how does the program prepare students for the NBEO throughout the program? And also, we do have a big Canadian population. So is there any support for students that are going to be taking Canadian boards in the future?
So I'll take this one. So during first year, actually, I don't want to say this is boards prep during first year, but our deans do, I would say, a really nice job integrating into the curriculum something called Jumpstart, which I like to think of as a series of seminars, essentially, that can teach students different good study strategies and best ways to retain information, because a lot of what is on national boards is what you're learning fall, spring, summer semester of first year, and you don't take part one, at least, of the US national boards until spring semester of third year. So you really got to make sure that you're learning the material and you're making it stick. So again, those study strategies, discussions on that do come up during first year. But real boards prep, kind of when you're in the weeds or in the thick of it, actually starts fall semester of third year. Students do take a boards prep course where faculty will come in and do review topics that are, I guess, high yield on national boards. In addition, they also do quizzes, so a lot of practice questions, and then essentially a mock part one exam where if you're, studying and taking the OAT, you know that the test in and of itself is a beast. You're in a testing environment for a lot of hours throughout the day. And so our students, were trying to mentally prepare them for, sitting in a testing environment for 7 hours during the day. So that does happen fall semester of third year. And then during externship rotation, so during your fourth year, is when you do take parts 2 and 3. You could be across the country, and so we use Blackboard as our learning management system, and we do have Blackboard organization sites for both parts 2 and part 3. Essentially, it's a lot of practice questions. Part 2 is essentially a case-based multiple choice exam, so lots of practice questions and lots of practice cases on Blackboard. And then part three is what we call an OSCE. We kind of took that term from our Canadian boards, but essentially part three, everybody in the US has to fly to Charlotte, North Carolina. And they're essentially moving through different stations with patient actors, gathering case history, coming up with a diagnosis, and then educating the patient on the diagnosis, treatment, and management. So we do actually, before you leave for fourth year rotations, do a mini mock exam with you to kind of get you mentally prepared for what you may experience in North Carolina. And then also all throughout third year, we have you rotate through what we call the boards part three room, where we have identical equipment that is in North Carolina that you'll use to essentially do recorded skills videos so we can provide you feedback as well too. So those are the three parts of US boards. For Canadian boards, this year will actually be the first year that we have the most amount of students, I guess you'd say, taking Canadian boards because prior our Canadian students could take US boards to get licensed in Canada, but that is no longer allowed to happen. So our large Canadian population now has to decide if they're going to stay in the States or head back to Canada. But if they're going to head back to Canada, they do need to take Canadian boards. So two parts to that. One of them is a written multiple choice test. And we do have, again, a Blackboard sites with lots of practice questions on that. And then for the second part, that's essentially like the US part three equivalent, where students do have to travel to Canada and work again with patient actors in different exam rooms and demonstrate skills. So we have some cases again on a Blackboard site for that. And then we've started to integrate into our part three room on campus the equipment that is used on that Canadian part two. So lots of opportunities for our students to utilize that equipment during third year. And then if they're around the area during fourth year before they go take that, they're able to access that part three room 24/7.
Excellent. Thank you for that very comprehensive outline of boards prep. And of course, there's a lot of different areas that optometrists can work in once they do enter their career. So how do we prepare students for different career paths in optometry? And what opportunities are available for those that are interested in like specialties and such? Dr. Beish, you think you could take this one for us?
Sure. You know, for the past 50 years, most optometry schools have prepared their students for a private practice setting, where they have their own little practice with a glasses area and a contact lens area and a technician. The world of optometry has changed dramatically in the last 10 years, where optometrists work in multidisciplinary practices, OD, MD practices in the military, in ophthalmic manufacturing and research, academia, in veterans administration, hospitals, departments of ophthalmology. And what we do is we are changing the mindset to prepare them to go into any of these disciplines that they desire. I'm sure we'll be talking about externships in a moment, but as you go from your first year to your fourth year, you'll start to hone in on what you really like to do and how you see yourself as an optometrist, as a practicing optometrist, and then diverge into whatever type of environment you wish to work in. The possibilities are amazing for optometry right now.
Absolutely. Definitely a very diverse career with all sorts of different opportunities depending on what your taste is. But on a similar note, where are students often finding work when they graduate, and what's our job placement rate, if you happen to know?
So I teach practice management, and one of the people who comes and talks to us is from Career Services here at MCPHS. And Career Services has somebody who is dedicated to optometry. And so they get prospective jobs. They have an alumni page. They have a LinkedIn page. They have a lot of access to alumni have a lot of access to jobs that are out there. But also optometry, we cannot graduate, not us, but nationwide, we cannot graduate enough optometrists for the number of optometry jobs that are out there. And so job placement is truly 100%. And it's really remarkable the different types of jobs that the students are getting. And, it, it, last night I was talking to an alum. He just finished his year of residency, and now he's got these three job offers, and we were hashing them out. One was in a hospital, one was commercial, and one was a practice with potential ownership. Three completely different things, all with pluses and minuses, obviously, like any job. And so it was very interesting to talk to him to sort of figure out where you headed. What do you want? What are you willing to do and not do? You get to choose. You are in the driver's seat. And it's been like that not only for as long as I've been teaching practice management, but truly for my whole entire career. Optometry, there have always been jobs. You will always have a job. It's an exciting, I want to say it's an exciting time to be an optometrist, but actually it's always been exciting to be an optometrist.
Absolutely. And I know that a lot of the individuals who are probably tuning into this session are prospective students who have, just finished their undergrad potentially, or maybe taken a couple of gap years, and are kind of, wondering what are they going to expect when they ultimately transition into optometry school. So would you be able to share how these incoming students should approach the transition from undergrad to optometry?
Yeah, I'll take that. I think it's, I mean, you have to come prepared. I mean, we've had some students who come in and they think their evenings and weekends should be off time for them. And it's like, no, no, no. This is a professional, medical program. You have to be prepared to come in and spend your evenings and your weekends studying and preparing for the exams and the courses next week. So, come in, ready to work very hard, be very dedicated. But that being said, I mean, you're not alone. It's not like you're just shoved into the deep end of the pool. Kathleen or Dr. O'Leary had mentioned earlier about our Jumpstart program. It's kind of a series of seminars to help you succeed, find your, what study methods work best for you. What are your learning strengths, things like that. We provide all of
Mhm.
this for you. We always, last year and this year, we're providing books, to as part of Jumpstart to help you understand effective study methods, because what worked in high school and undergrad probably isn't going to work because in a professional program because it's just like a fire hose of information coming at you. And so you kind of have to strategize and change the techniques and the ways you've done that. We also have a Jumpstart clinic program before you start your clinical training where we, try to ease you into that transition from just didactic education into your clinical training. So, come hungry, come excited, but come ready to work. That's what we really need. Because if you put in the work, I mean, between the effort you put in and the support we'll give you, I mean, you can just blow this, the whole program out of the water and find incredible success.
One of the things that we've been working at, especially over the last few years in the Jumpstart program, is to change the undergraduate mindset from trying to get the highest GPA possible by cramming, by shoving all the information in the night before and then getting a good grade and then forgetting everything. It's all about retention in optometry, and that's what we've made a tremendous amount of progress in working with students to change that mindset. Just learn the information. That's the important thing, and retain it and keep going over it.
Absolutely. And I'm sure that this is kind of maybe a little redundant, but if there is any piece of advice that you could give to someone starting an optometry program, what would it be? And I'll leave this to any of you to answer.
I would say study like there's a quiz tomorrow. You just got to study, and then like Dr. Waldorf said, you really do need to retain the information, because we don't know who's going to walk through the door, and so you might be have a patient in front of you that has a disease that you haven't talked about for 2 years. Well, if the patient's still here now. You don't get to just forget things, and or maybe 10 years from after you graduate, somebody walks through the door with something. So you have to just retain everything that you're learning, and so you need to study in a way that allows you to have success on the program.
Because if you could have a super high GPA and walk into clinic and be a train wreck, I mean, it's possible, so, and I've seen it, we've all seen it. So, just because, I mean, I would rather you have a lower GPA. I mean, no patient's going to ask, what was your GPA in optometry school? I'd rather you have a lower GPA and understand the material and come into the clinic and be a rock star, than to have a really high GPA. I mean, I'm not saying a high GPA is a bad thing, but it's just kind of a shift in that perspective. And in order to find success, you really have to modify how you approach your studying techniques.
My main advice would be to be curious, ask questions. It's something that students don't do very much these days, and the ones that do better. Ask questions, reach out for help if you don't understand something or need clarification. Our faculty, any faculty member who's in their office, you will find the door open. Yeah, we all have posted office hours, but nobody will be turned away. If you come with a problem or need a little hand holding or need some clarification on something.
Absolutely. This is definitely not the type of program that you need to suffer in silence whatsoever. There are a number of different resources out there, so use them. They're there for you. So we're going to wrap up this Q&A with just one final question that I think will be fun for you to answer. So feel free, any of you, if you'd like to jump in. But what makes you excited about the future of optometry and the future of the industry?
So I'm super active in the advocacy and the political role of optometry as a profession, both in the state and in the nation. And we're in such a great place. There are so many advances in technology and diagnostics and treatment options that were not around when when I graduated. I say all the time in clinic, oh my goodness, this thing didn't even exist for at least 10 years before I was out not using this thing. And now I can't imagine practicing without this piece of equipment. And that has always been the case. And so if you are, it is a job of lifelong learning for absolutely true. You need to be adaptable and curious and committed to lifelong learning. And this profession, the future of optometry, is just it's such an exciting time to be an optometrist.
Well,
Yeah.
thank you so much, everyone. Oh, did you want to add something,
I was
Dr.
just going to say,
Waldorf?
I mean, I graduated 30 years ago, maybe similar to Jen, and my gosh, the stuff that I've seen, I mean, everything we used to do had to be drawn on paper, and now, on a microscopic level, I mean, the technology can image just little changes from year to year. It's just phenomenal, and I think it's kind of been alluded to several times, but just the variety of opportunities you have in the profession. I mean, that makes me so excited. So if something's not working for you, you have other options.
Absolutely.
The Pew Research Company does an annual survey of people's attitudes toward different professions. With used car salesmen coming out at the bottom and attorneys coming out near the bottom, and interestingly, an optometrist always comes out in like the top 5 or 10 of all the professions. People like their optometrist, they trust their optometrist, and that is going to continue into the future. And all these great technologies and an increased scope of care are only going to keep making it better. So it is a tremendous time to be an optometrist. The jobs are out there, and you can the world is your oyster, as they say.
Absolutely. Good work-life balance and salary as well. There are also great resources for those of you who are considering optometry through ASCO, which is the Association for Schools and Colleges of Optometry. They have eye-opener sessions, which can connect you with an optometrist as a mentor to kind of answer any questions for you. So if you're still kind of getting your, feet wet into the world of optometry, that would be one place I would encourage you to check out. But for now, if you have any questions about MCPHS specifically, you're welcome to contact our admission office and get in touch with me. And we hope to, help you out in the future, see your application. So don't hesitate to connect with us at any point. And I want to thank our wonderful faculty members for their advice and expertise. It's always wonderful to hear from you guys. So thank you so much. And I'm sure our prospective students will also appreciate hearing from you as well. Take care, everyone.
Thank you.
Thank you.